Good afternoon, and thank you for joining us for the fourth of 5 total pre-conference webinars being offered in preparation for the upcoming Adoption Support and Preservation National Conference, May 31st through June 2nd. Before we begin, I'd like to take a moment to go over a few housekeeping items related to today's webinar. First, you will notice a Zoom viewer button in the upper left-hand corner of your screen. You can use this button to adjust the size of your webinar screen. Secondly, in the control panel located on the upper right-hand side of your screen, you will see the word Questions listed. Use the plus and minus button to open up or close the question box. This is where you will want to type in any questions you have for Kim and Nicole. The presenters will respond to questions at the end of the webinar. In the event we run short on time or can't get all the questions, please know that Kim and Nicole are committed to responding to these offline. I will send the questions and responses to all registered attendees. And now, I am pleased to introduce our presenters for today's webinar, Kim Stevens and Nicole Dobbins. Kim Stevens serves as the Director of Advocates for Families First, an alliance of the North American Council on Adoptable Children, Generations United, and the National Foster Parent Association. As Director, Kim oversees advocacy efforts on federal and state policy agenda, capacity building for caregiver support advocacy organizations throughout the United States, and manages communications and messaging efforts to elevate the visibility and positive image of kin, foster, and adoptive families and the children and youth they care for. In her 25 years of child welfare work, Kim has provided training and consultation on kinship care, foster care, adoption, parenting, positive youth development, advocacy and leadership, trauma and recovery, and youth permanency issues, both nationally and internationally. She and her husband, Buddy, have 6 children, 4 of whom were adopted from the public foster care system. Nicole Dobbins is the Executive Director for Voice for Adoption in Washington, D.C., a national advocacy organization whose mission is to speak in a single voice with policymakers, representing the interests of foster children awaiting adoption and the families who adopt them. Previously, she served as Director of Events for Foster Club, the national network for young people in foster care, where she was responsible for engaging young leaders from foster care to train 2,500 foster youth annually across the country. She now serves as president of Foster Club's Board of Directors. Nicole has testified on 2 separate occasions in front of the United States Congressional House of Representatives for the Committee on Ways and Means, once as a young leader, sharing her personal story about aging out of foster care, and once in her current professional capacity. Nicole has also served as a spokesperson for the National Foster Care Month campaign and was recognized in 2008 as one of 10 outstanding young leaders by the Kids Are Waiting campaign, a project of Pew Charitable Trusts. As an alumnus of Oregon's foster care system, Nicole leverages her firsthand experience and passion to effectively advocate on behalf of young people currently living in foster care. Kim and Nicole, thank you for taking the time to share with us today. Welcome.
Thank you so much, Robert. I want to welcome everyone, just express our appreciation, both Nicole's and my appreciation, for your interest in this very important topic. We're going to be talking today what's in the new law about passage of the Strengthening Families Act, which is officially called the Preventing Sex Trafficking and Strengthening Families Act. This act that was passed last fall is creating increased investments in post-adoption services as well as opportunities for state-level advocacy. And we hope that you will both learn some things and find out that there are opportunities for you to take action on the local level. And with that, I turn it over to Nicole.
Thank you, Kim, and thank you, organizers. We're really pleased to be here and share information with you about what's happening at the federal level, and that will affect all of us, both at the state and local level. And so we hope that what we share with you is not only informative, but also action-driven, so that you can take this information and see how this pertains to you at the state and local level. So as we just give an overview of the workshop, or webinar, if you will, we're going to tell you a little bit about what we do as our individual organizations and how we collaborate together. We're going to analyze the new law, Public Law 113-183, as Kim Stevens just shared, Preventing Sex Trafficking and Strengthening Families Act, that was passed in 2014. We're going to share about what kinds of opportunities this is offering to leverage at the state level, particularly in regards to post-adoption support services. And then we're going to share kind of some overview of what's on the horizon in terms of federal child welfare and policy, and as it relates to what Congress is working on, what they're talking about, and just give a landscape of what's being discussed at the federal level. So if I can just tell you a little bit about Voice for Adoption. Our organization has been around since 1996, and we're an advocacy organization right here in DC. We're membership-based, but we advocate specifically for the 102,000 children who are waiting to be adopted and families who adopt domestically. And so what that means is we have an advocacy agenda, and we work towards educating members of Congress. We do very little lobbying. Largely the bulk of our work is about advocacy and educating staff that work on these issues for federal legislators, highlighting what policy barriers exist, and sharing where good practice is happening, sharing the experiences of young people who either are waiting to be adopted or have been adopted, and also sharing the experiences of adoptive families. So we analyze and track child welfare legislation. We develop policy calls and webinars and fact sheets. We also develop sign-on letters and respond to federal legislation that's put out. We provide testimony when needed, and we create advocacy sign-on letters for the broader community to show support, because we know that every one of you that probably are on this call are doing the good work of on the ground working with families, and so we are really the eyes and ears about what's going on at the federal level, and helping to communicate or be that liaison between on the ground and informing policymakers about what's important. Kim, are you there?
I am. So North American Council on Adoptable Children works very closely actually with Voice for Adoption. We're a member of their organization, several of us as individual members, but also as an organizational member. We were founded in 1974 by adoptive parents, and actually started as a parent support group that over time grew into an advocacy, education, and awareness raising organization. We work in both the United States and in Canada. We really think a lot and advocate strongly for the fact that even though children cannot always remain with their birth families, that really any child is adoptable, so to speak. That there is not a child for whom there isn't a family out there. We just really have to look at how we're doing our work, how do we best support families, how do we best think about matching the needs of the children with the abilities of the families. And we have seen over time that there are some incredible families out there that can both raise and help to bring children to their most positive and their most successful abilities. We also work in Canada, for those of you that don't know us, and I will also tell you a little bit about Advocates for Families First. That's an alliance, as Robert had indicated, of the National Foster Parent Association, Generations United, and NACAC. The reason why we've come together, and we've been doing our work now since January of 2014, is because we feel that there are children out there who are in either kinship, foster, or adoptive families, all of whom have similar needs for both support and services, yet according to policy and practice, those needs are met in varying levels depending on their placement. We are advocating strongly for the fact that regardless of a placement, a child still has their needs met according to the need. And we also realize that when foster, kin, adoptive families, and the children and youth that they care for speak in one voice, it's far more effective in terms of getting advocacy. So now that we have told you a little bit about who we are, we're going to open 2 polls, one after the other, because we want to find out who's on the line. I'm launching our first poll now. What role do you play? We'll give you some time to complete that. We have just about 80% of folks who are on the line that have completed the poll. I'm going to give a few more seconds for everybody to have a chance to weigh in. And sharing the results with folks. So you can see that over half are private agency providers, about a quarter are public child welfare folks, and equally divided amongst administrators and mental health providers. The second question that we're wondering about is where you're from. So we're now launching a poll to indicate where folks are from. The north part of the country, south, east, west, or if you're representing international adoptions, we would like to know that as well. We have just about 3/4 of the folks now, almost 80% have weighed in. And I'm going to share the results with you. Over half from the south, and then equally divided among the north, east, and west of the country. Thank you. We appreciate that because it helps us as we're moving forward to know who we can help and how we can help them. So I'll turn it back over to Nicole.
Great. Thank you for participating in our poll. So let me just dive into the new law and what's in it. In a moment, you should be seeing the slide that gives the overview of the different titles of the law. I'll give Kim a second to pull that up.
Nicole, it's up on my screen. It's not up on your screen?
Well, that's fine. I'll pull up the regular webinar. It's not. It didn't switch back. What about others on the call? How will we know?
That's an excellent question. Can folks, if you can see Preventing Sex Trafficking and Strengthening Families Act, PL 113-183. Can you please raise your hand? There's over by your name that you can click on.
I can now see it, Kim. So maybe it just was a delayed reaction. So let me go ahead and get started. So on September 29, 2014, President Obama did sign the Preventing Sex Trafficking and Strengthening Families Act. It included 3 titles. I want to just say that this bill was in the making for over 2 years. There was an incredibly bipartisan process that took place. In the Senate, it was championed, or the jurisdiction, if you will, of child welfare issues goes through the Senate Finance Committee. In the House, it's the Ways and Means Committee, which is actually the subcommittee on human resources. So it was originally HR 4980 when the first draft of the bill was put forward in the House. When I say it's bipartisan, I say that in both chambers, this bill was introduced with bipartisan support and continued to have bipartisan support, and ultimately was passed by unanimous consent in last fall. When I say that it was 2 years in the making, I think members of Congress did a good job of inviting public comment on different drafts of the bill, starting from the very beginning, and they posted that for public comment for all agencies and organizations and different stakeholders to make comments throughout different periods of the different versions that were introduced. Ultimately, this is the bill that we ended on, and it's Public Law 113-183. There are 3 titles. Ultimately, the bill improving, or ultimately the real driver or the vehicle for the legislation was the Adoption Incentives Program, and the fact that that program was expired and due for reauthorization. Other pieces of the bill, such as the Preventing Sex Trafficking pieces, were added largely because a number of members of Congress, both from child welfare arenas but also in other areas that focused on law enforcement, have been seeing the domestic increase of sex trafficking in general, and particularly victims as young children. So you can see where this has intersected with child welfare, and I'll share a little bit of the statistics there in a moment. But the 3 titles are as what are on the screen. The third one is Improving International Child Support Recovery, which really amends provisions to ensure access to child support services for international child support cases. And we won't really be talking about the third part of the title. So let me jump into the pieces that pertain to sex trafficking, and I'm just going to give a broad overview and not go into great detail because I think we want to focus the majority of our time on the opportunities around advocacy for post-adoption services. So as members of Congress were hearing, particularly in a number of jurisdictions across the country, child victims were coming to the attention of law enforcement and actually presenting themselves as prostitutes, but they were recognizing that they were young children as victims versus prostitutes. But many of the young children were actually being detained as prostitutes versus child victims. And so this is obviously alarming and intersects with child welfare in a big way. And so some of the reporting that was shared that led up to what is legislated reports on the majority of children involved in sex trafficking had a large part of either currently being in foster care or having some sort of involvement with child welfare system in the past. And they actually highlighted a few areas across the country that were already doing some reporting, but large in scale. Child welfare did not do any reporting on victims of sex trafficking, and so that's a big part of this bill. In fact, actually, some of the jurisdictions were Los Angeles County, the state of Oregon, Connecticut, Florida. So some areas had high risks or high population that this was affecting, and that was really driving some of the research of what we did know in terms of reporting. But for large in part, we don't know the large volume of how this affects children across the country. And so this part of the law targets better documentation. And so in 2010, officials in Los Angeles reported that 59% of juveniles arrested for prostitution were in the foster care system. So those are some of the statistics that were leading the need to legislate in this area. Of children reported missing to the National Center for Missing and Exploited Children, who are also likely sex trafficking victims, 60% were in foster care or group homes when they ran away. So there was some data that, again, drove the need to legislate in this area and require that child welfare agencies be informed about this population and do better tracking of this population. So there are basically 5 sections of the law that focus on the sex trafficking, and it's really about identifying and protecting victims. Section 1 is all about identifying, documenting, and determining what services for youth are needed, and that after 1 year of enactment, states must develop in coordination with local law enforcement, juvenile justice systems, healthcare providers, educational agencies, and other organizations who are experienced in dealing with at-risk children, policies and procedures for doing that. So for documenting the prevalence and determining what appropriate services are. In addition, states will be required to immediately report within 24 hours children under the responsibility of the state who are identified as victims to law enforcement. Additionally, in terms of better data collection, states are now also going to be required to submit data through our AFCARs, which many people should know what that is, but if not, it's the Adoption and Foster Care Analysis and Reporting System. It's the system that states already use to report data to HHS on a variety of indicators. So it just adds to AFCAR's a domain to include sex trafficking victims. There has to also include plans to locate any missing children from foster care and respond to the reasons for their for a child who has gone missing. Large in part because a lot of victims, a lot of children who go missing or are runaways become these victims of sex traffickers. And then lastly, the last section in this title, or Title I, is requiring increased information to children to prevent sex trafficking. And so in a nutshell, those are the requirements to states on Title I. I didn't mention the National Advisory Committee on Sex Trafficking, but that bill also establishes this committee, in which I believe they have 2 years to come up with recommendations and identify best practices around preventing and providing support services to victims who are involved in child welfare.
Thank you, Nicole. The next piece that's coming out actually, again, comes from, initially it came from, I believe, the state of Florida, and through their Florida Youth Shine program, young people had come forward and had been speaking to legislators about the fact that when in foster care, many children are not allowed to have sort of a normal childhood, normal youth growing up. Such things as being able to have extracurricular activities, join a sport team, have a pet, stay at a friend's house overnight, go to the prom. Many of those things that we assume are sort of a normal part of growing up are denied those kids, or are made very difficult because whoever the child is going to be with has to go through incredible scrutiny, criminal records checks, and the rest. So each state is being asked to implement a reasonable and prudent parent standard that is going to allow foster parents and licensed kinship caregivers the ability to make decisions really in the same way that they would for any child that they are parenting. States are going to have to look at their licensing rules and their policies to ensure that there is an appropriate coverage and an appropriate way of looking at caregiver liability, and they have 1 year to implement the provision. I would say, and I think Nicole would agree, we are going to have to really be advocating strongly around this particular provision of the bill, because already the legal system is voicing lots of concerns about liability. And I think caregivers as well are very concerned that if the questions are not answered ahead of time about what will they be responsible for, what happens if somebody gets hurt, you know, who ultimately is going to be answering for any kind of questions about a child being hurt or something going sort of wrong, if you will. That's what's getting in the way right now around the normalcy piece. And we're really looking to try to help both caregivers and youth have a voice at their local level in order to inform policies moving forward. Nicole?
So another part of the law restricts the use of APLA, which is another planned permanent living arrangement. So the background on APLA is that it is actually one of the 5 permanency options under the federal government recognizes as a permanency goal. APLA was actually added as a permanency option under the Social Security Act in 1997 when it replaced long-term foster care. But in reality, both the federal government and many states still refer to APLA as long-term foster care, and there's a recognition that many children who are assigned a case goal of APLA are unfortunately, if you will, doomed with this case goal, and little permanency is really done in terms of recruitment or the ability to establish a more permanent goal once APLA is assigned. We know that many of the young people who have a case goal of APLA are children who actually eventually exit foster care with no permanency at all. And so what the law actually does is restrict the use of APLA. It is no longer, after 1 year of enactment, so by September 2015, no child will, under the age of 16, will be able to have the assigned goal of APLA. States also must document at hearings, of permanency hearings in court, how intensive, ongoing, or unsuccessful efforts to find more permanent placements were attempted, which there is in law that mentions the inclusion of biological family members. The state agency must also describe for children who are above the age of 16 why they believe APLA is still the best option. So that's already in current law, but it reiterates the importance of ensuring that even if a child is above the age of 16, there has to be determination in court that describes why APLA is still the best option. Under this section of the law, they also just reiterate what Kim talked about reasonable and prudent parent standard, and just mentioned particularly that it be followed here. There is a delay for tribal governments and Native children, being that they are a subset of population in which children in those circumstances may not or may honor different types of family relationships in a way that may not be recognized in other populations. And there was a concern there that they have some further time to have discussion around how this population might really not benefit if APLA was removed for them, largely in part around customary adoptions and other things that I'm a little bit less familiar with, but I know that some of our partners that are working in this area are definitely eager to have conversations about improvement. So that was at least given for consideration, and there's a 3-year delay. One question that has come up from states or agencies across the country is whether or not this includes some kind of grandfathering clause, and the answer is no. Any child who's currently in care with a case goal of APLA, given the year of enactment, they have to their case goal will have to change. Their permanency plan will have to change. So that is the provisions as it pertains to APLA. Is this me as well, Kim?
Yes,
Yes,
Nicole.
it is. Okay, so sorry about that. Section 113 requires that children 14 and older be consulted in the development of their case plan. Again, this is really recognizing that with the more that we learn, young people can be huge advocates in their case planning. They can also identify people who can be a part of their team and potentially permanency options given the chance. And we know a lot from some of the work with the studied Wendy's Wonderful Kids recruitment and some of the testimonials that came from young people there. But we also know that this is good practice as well, and I think this was just an effort to embed what we know about youth involvement in case planning into federal law to further this practice across the country. So young people, once they reach the age of 14, states are required to work with young people to help them invite or allow them to invite two people who are identified by the youth to be a part of their permanency planning team. The law actually does stipulate that these two people should be someone else besides the foster parent and the caseworker. Of course, if there's concern for safety measures, a caseworker can reject one of these individuals. Additionally, states are required to provide written notice to young people starting at the age of 14 again, a list of their rights. And so many states are already doing this. They provide a list of rights rights of being in foster care, what opportunities are available to them, but this is now codified in federal law that it's a requirement for states to outline these measures to children starting at the age of 14 as it pertains to, but not limited to, but in law as it pertains to education, healthcare, visitations, and that's visitations with siblings and other biofamily, court hearings and other court hearing participation and other rights to be safe. When it says rights to be safe, the conversation, particularly in that piece, as I'm understanding it, was around the right to be safe and any potential language that can be shared with young people to keep them safe from being victims of sex trafficking.
And I just want to add to that one, Nicole, and then pass it back to you for the next slide, that there are, I apologize, there are a number of states that have already passed these laws, the Bill of Rights, and we're very happy to share some examples. Particularly, we're interested in sharing examples where the youth themselves have participated in developing the Bill of Rights for foster youth, because we know that they, with the youth input, are going to be probably more pertinent to what the youth are concerned about, and also that whole idea that if you plan the battle, you don't have to battle the plan. So we really encourage folks to be looking to their youth to help guide the development if you don't already have the Bill of Rights in place. And Nicole, I will pass it to you now.
Okay, if you want to advance the slide. Okay, so this is just follow-up to what we were just talking about regarding youth empowerment and list of rights notification. In addition, states are also required to provide free annual credit reporting and to help young people who have any issues on their credit to resolve any inaccuracies. This is actually already in law. It was age 16 and older, but now this federal law moved it down to age 14, I think, to be consistent with other pieces of the legislation here. I think it's also recognizing the preparation and an earlier involvement of young people in their case planning. The state also is required to not only provide these lists of rights, but provide a document that they have signed acknowledgement by the child that they've received the rights to them, and it's been explained in an age-appropriate way. I think there was a concern by many young people that these conversations just weren't happening around a number of issues, and so this text in which it was placed in federal law, explained in an age-appropriate way, kind of gives some nod to the fact that caseworkers should be engaging with young people to have these kinds of conversations. And then the last bullet there is just the requirement that states, that HHS report to Congress on the analysis of these particular provisions and how states are doing to share best practices across the country.
So the next piece also goes into empowerment, because obviously youth can't really do anything in terms of purchasing things, going to school, getting health care without their documentation. And we do know that there's been a number of occasions in the past where young people have aged out of care without personal documents. So we're now saying that by law, youth who have been in care for at least 6 months must be provided with a legal copy of their documents, including birth certificate, social security card, driver's license, or an identification card, and medical records. There is a year to implement the provision, and if you are in a state where there is legislation that's required, there will be more time allowed. Again, we encourage you as advocates to find out what's happening in your state and to weigh in so that we can get this implemented faster rather than slower. We do also know that California has some great legislation around documentation, and that can serve as a template. And as I recall, that legislation was pushed by the California Youth Connection, which is one example of an excellent way that young people who have been in care and alumni can work together to make sure that we are doing the best job in terms of providing for our young people. And then if there is advocacy needed to go beyond the law, or there is actually advocacy needed for states to go beyond the law and provide additional proof of time and care for college financial aid, Medicaid to 26, and other benefits that might be available to youth. So just a real quick overview. The documentation here is listed, and then the advocacy needed. And we're very happy to help you if you're trying to put together advocacy plans around providing the additional proof of time and care. Nicole, I just want to do a time check real quickly. We're at 1:36. So I'm going to keep track of that myself.
Great. So the next section, we're going to move into the adoption incentives reauthorization of that program, and really it's an expanded reauthorization. And I'll just say, in looking at the whole bill and analyzing what the whole bill is about, I just want to step back and say, I think largely this bill does three things, or it really promotes three things: protecting youth and keeping them safe from what makes them vulnerable, providing for increased opportunities for youth empowerment or youth engagement, and then this real push for permanency for all young people and strengthening supports to families. And so as we look at the adoption incentives program and how it was altered and expanded, I think it really points to the third part of that, is pushing for permanency for all young people. I think for a long time, the field has argued that the adoption incentives program is not expansive, that we're only incentivizing one permanency outcome. And there was a lot of advocacy to include permanency incentives for kinship and legal guardianship. And so the program, fitting based on advocacy and the progression of policy, as advocates have raised concerns, was changed in this way. It was expanded to also be renamed as the Adoption and Legal Guardianship Incentives Program, and it was authorized for 3 years. And the reason for that, it's programs like this are usually reauthorized for 5 years, but it was reauthorized for 3 to sync up in fiscal year 2016 with the reauthorization of the Promoting Safe and Stable Families program. So the Adoption Incentives Program historically has given state bonuses or incentives to states for increasing their overall adoptions above a baseline. And so this now, based on the new law, will provide incentives to states for increasing their adoptions, but also their guardianships. It also moves away from baseline numbers and provides improvements to states, a phased-in opportunity for improvements to states for rates of increased increases rather than raw baseline year numbers. And the importance of that is that with the number of looking at the national data and the number of caseloads of children in foster care declining over a number of years, at least the last 5, it was harder and harder for states to reach a baseline that they achieved in 2007. And so the new incentive rates will be categories will be based on rates versus baseline numbers from 2007. So these are the new categories. It provides incentives for $5,000 for foster child adoptions, $7,500 for pre-adolescent child adoptions or guardianships, and that's ages 9 to 13. $10,000 for older child adoptions, ages 14 and older. Again, this is focusing on the importance of providing permanency for older youth, looking at our aging out numbers, and recognizing that permanency outcomes are important. And then lastly, this $4,000 category for overall child guardianships. These are all in effect now. The current numbers should be coming out in late September, October. And then the full rate phase-in will be phased in over the next 2 years. So the adoption assistance D-Link savings, I should have had a poll question here, Kim. I don't know why I didn't think about this earlier, but I always like to ask how many people know what I mean when I say Title IV adoption assistance D-Link savings. So because I didn't do that, I'm going to give a little bit of an overview of what that means and tell you how it's built upon 2 existing laws, or this provision in the bill has been being built upon 2 previous bills. So in 2008, when reform happened, known as the Fostering Connections Law, or the Fostering Connections to Success and Increasing Adoptions Act of 2008, what that bill did was de-linked a child's eligibility from AFDC, which is an outdated program known as Aid to Family with Dependent Children. And so you might know that that's being phased in through fiscal year 2018. Well, when that was delinked, there was congressional intent to retain those dollars that states would be saving while the federal share would be increased. It was also required that these, as I mentioned, that these dollars be reinvested back into child welfare services. But over the time, we've come to know that there hasn't been a real tracking of what these savings have been. So Section 206 of this law requires that states have to annually report any savings as a result of the 2008 D-Link to HHS. They cannot supplement or supplant any funds, meaning they can't utilize what would have been spent here in other areas, that this is a true reinvestment into child welfare services. Additionally, advocates spent some time raising concerns around the need for greater dollars into post-adoption services, and so the federal language also requires that states spend some of this D-Link dollars into certain services, of which includes post-adoption services. So the way it's actually written is that 30% of the savings have to be spent in 3 areas, with at least 20% being spent specifically on post-adoption or post-guardianship services. So what can advocates do for this? They really need to become familiar with this provision, the history of this provision, and understand the new requirement, and here's why. This is a pot of money that will grow in terms of the state savings and therefore the state reinvestments made in these categories. This is a requirement by federal law, so states will be required and are currently required to report what savings are being reinvested. And I think you could look to the state of Minnesota, who has designated at the state level 100% of their savings into post-adoption services. But at the federal level, there has to be at least 30% reinvested into the services mentioned before, with 20% on post-adoption, post-guardianship. Ways to do this. So people have asked, you know, who to ask, who to have the conversation with. I think your local officials, your local administrators, HHS, organizations who represent or are stakeholder organizations really need to start the dialogue about what dollars are being saved in states. I've created a 3-page, very simple fact sheet about the history of this, what was changed, and how much money we're talking about in terms of savings here that is required by federal law to be reinvested. And you can access it using that link there. I talked a little bit about the history, and I know we're coming down on time, so I'm going to skip to the next slide here. And I also talked about this, so I'm repeating myself here. So Joe Kroll, who was the former executive director at NACAC for, I don't know, 35 years, don't quote me on that, but has been doing estimates for each state in terms of savings in regards to this provision. These estimates are based on savings of populations particular to each state as the phase-in from the D-Link happens through fiscal year 2018. Estimates are based on penetration rates and subsidy rates, and it's going to be different for each state. So you see, obviously, states with larger populations or higher penetration rates will benefit the most. However, every state will stand to gain some amount of money in terms of what would have been saved and has to be reinvested in child welfare services. Joe Kroll still has made himself available, and we can provide contact information if you're interested in knowing state estimates for your particular state if it hasn't been listed here. Again, we are trying to provide HHS with some of these calculations that Joe has come up with. We've had a couple of meetings. We recognize that HHS has not given guidance on this yet, and we know that states will need some technical assistance to develop the calculations around what savings are happening in each state.
Whoops.
And so here we go. This is one of the reasons why there's advocacy and why this was added to the new law. So in May 2014, the Government Accountability Office did a report and found that although states are already required to spend any savings from this D-Link in 2008, only 21 states, reported calculating any savings, and then 20 states reported difficulties performing these calculations. And so we've done advocacy encouraging that HHS provide the specific calculation in order to really help with the technicality of this and around the methodology being used. But in current law, it does require that either states have to provide to HHS the methodology used to determine savings, or that HHS provide the methodology to states. And so again, what advocates can do is start having the conversation and the dialogue around what types of savings and bringing attention to this. I think a lot of people aren't understanding the importance of this, the fact that this is a pot of growing money that will continue to grow through fiscal year 2018 as the federal share continues to increase over those years.
Thank you, Nicole. We also want to talk about another place where we are going to be looking for advocates to make sure that we are doing the right thing in terms of our children. So one thing that has happened with this new legislation is that successor guardians will continue to be able to receive guardianship assistance program. What's happened in the past is that if a guardian had deceased, children would have to come back into care in order for those guardian assistance payments to continue. And one of the pieces that we have been raising at the federal level, and we are still awaiting guidance, but the feds are definitely listening to the advocates about trying to sort through all this, is that there is a similar issue for children who have been adopted. If their adoptive parent or parents have deceased, they have to be readopted. They have to come back into care and be readopted before adoption assistance payments can continue. Although they would still be eligible, there will be a gap. And so what we're hoping for is that with this successor guardianship piece, we will have established a precedent to do the similar thing for kids who have been adopted.
So can I just add a clarification there, Kim? So we actually did some advocacy and recognized that in the current, so this actually built on the adoption assistance, successor adoption assistance, and that actually currently exists. It's just unclear, I think, to some states that they can pay in the interim, and it actually was to encourage and to ensure that children didn't re-enter. And so as we're waiting for HHS to provide guidance, we're asking for them to also clarify that this already exists for successor adoption, and that as successor guardian was put in the current law, that it actually built on successor adoption, and that we just provide clarification to states that this can and does already exist in current law.
Well, that's excellent to know, and I'm going to follow up with you because we've had a couple of states where caregivers have contacted us concerned about the fact that their children were going to have to be re-entering, the adopted children were going to have to be re-entering care. So clearly the states are needing some guidance from the feds in order to...
Yeah, we learned that too. We learned that it was confusing, and we found that it's in different parts of the child welfare policy manual. So I'm happy to share that. I'm happy to share that with anyone on the call if there's concerns here as well.
Super. Thank you so much, Nicole. This next piece is just some information for you, so that folks will know which states already have guardianship assistance payments. Those in orange had already had a prior subsidized guardianship program. Those in purple did not have a prior program, and those that are in gray do not have the guardianship assistance program in place. So those are states that perhaps are going to want to look at doing some advocacy to get this going. One of the things that we do know is when we do have the successor guardian and we have the guardian assistance program in place, it oftentimes will make it possible for relatives to be able to step up to take care of the children that are born into their families and also have the financial support that they might need.
So another part of the law, of which members of Congress have had some heightened attention given media reports around adoption, what we don't like to use, but as adoption rehoming or dissolved adoptions. There has been an interest, and a growing interest, I think even before the media reports, on an interest to further collect data on what happens to children after they go to adoption. And so actually there's now a requirement that states do track dissolved and disrupted adoptions, and it's actually detailed, and it also includes guardianship, dissolved and disrupted guardianships. And it's asking for detailed information on the length of placement, the type of placement, meaning was it public or private, whether the child came from, is re-entering foster care from a public adoption or an international adoption. And so it's requiring quite a bit of new data collection on disrupted or dissolved adoptions than was ever required before. And if you paid any attention or knew that the AFCAR's notice for public comment, it definitely included these questions as they're developing the new data sets around AFCARs. So this is a part of this law and should give us information probably in a few years to come, but what happens to children when they do disrupt and dissolve, and what types of situations do they come from. So notification of sibling placements was an addition to the 2008 law and builds on relative notification. And it actually came from a state, the state of Iowa, where they argued this at the state level and passed a state law. And it just clarified that when a child comes into foster care and their sibling has already been adopted or has been in another caretaker's with another caretaker, excuse me, that they are included as a relative as consideration for siblings, so that they can be included in the notification and be at the table as it pertains to what's going to happen long term for permanency outcomes. And lastly, the Family Connections grants that were first established in the Fostering Connections Act were extended for only 1 year. There was a considerable amount of advocacy that was done to continue these for 3 years for the extension of the term of the bill. But we actually were only successful, and they only were able to find an offset to pay for $5 million of the current grantees, and actually that was funding for the last year of current grantees in the areas of kinship navigator programs, family finding, family group decision making, and residential family programs.
So this next piece, the Improving International Child Support Recovery, as Nicole had indicated in the beginning, is not really related to our work. If there is anybody that is on the line that needs more information, we are happy to connect with you later. And then we also want to point out to you that there has been a program instruction released from Administration for Children and Families, and if you Google just this citation here, ACYFCB PI 1406, there is some detailed instruction on how the relative identification and notification to include siblings and the incorporation of successor guardian is to be done. There's also information there around the effective dates and what's going to happen in terms of applying for a delayed effective date if you do need state legislation. And there's additionally information on submitting your agency plan amendments. So that, especially for administrators, is going to be very helpful. But I think also for advocates, just in terms of knowing what your state is having to comply with and what that compliance looks like, it will help to inform your arguments and presentations.
So I'm going to really quickly speed through this because I want to give opportunity for a couple minutes if we have time for questions. But looking forward beyond this year and what's on the horizon and opportunities for advocacy, there's a landscape that is happening in terms of conversation at the federal level about what the federal government incentivizes right now with the majority or the bulk of their money to states around foster care and child welfare, recognizing that the majority of dollars spent are on out-of-home placement. There's a real interest to invest in prevention of foster care and keeping families stable. And so what that means is that the federal government is looking at the current structure of Title IV-E and figuring out, are there ways to alter the structure so that we can do a better job where we know services are most effective. And so that's kind of the climate of discussion. It builds on finance reform in child welfare over the last few years that has been being discussed. And there are a couple of things that I want to bring your attention to. Last week, Senator Wyden, who is the ranking member of the Senate Finance Committee, a Democrat from Oregon, introduced a draft proposal seeking public comment and support for a proposal that would change some of the structure, meaning it would allow for Title IV-E entitlement program that's normally just used for out-of-home maintenance payments to foster parents to fund a set of prevention services for children who are at imminent risk of entering foster care. He also provides for enhancements to post-permanency services in the portion of the bill where he requires $1 billion, so increased investments into promoting safe and stable families program, to make that funding mandatory versus a mix of discretionary and mandatory. Discretionary funding is always subject to cut, and that program has been being cut over the years, so it's been diminishing in the pot of how much dollars states get. So this is a really exciting proposal. It's one of the first that includes investments with new dollars around services that the community has been advocating for a long time. So I encourage you to go on the website and see that and make comment. Additionally, the President's fiscal year 2016 budget does similar things in terms of making improvements to child welfare services with promotion of post-permanency and prevention dollars, increases family-based care versus congregate care, and does a number of other things that I don't have time to talk through at this point. But again, I encourage folks on this call to have conversations and really be raising this on the ground as important. Additionally, there's an upcoming hearing scheduled for next Tuesday, May 19th at 10 a.m. Being held by Chairman Hatch, the chairman of the Finance Committee, a Republican from Utah, on how to safely reduce the reliance of foster care group homes, of which an adoptive father is speaking, and a young lady who has experienced group care. There's the link there, and it will be streamed live. So all of these things are efforts in which are happening at the federal level to figure out the structure of financing and whether the federal government is currently, with its current structure, incentivizing the right things.
Thank you, Nicole. Lastly, we just want to point out to you that we do have resources available that we would be more than happy to share with you. We can assist with data collection. We can certainly offer assistance with understanding the funding streams and how to promote the spending plans that will support our youth and families. We also have assistance in developing your legislative language, program proposals, or action plans, and certainly the Keeping the Promise papers that came out from the Donaldson Adoption Institute, one in 2011 talking about what model programs look like and what research is showing helps with post-adoption, post-permanency, and then the follow-up that came out, I believe, in 2014 that cites what each state is doing are great for sort of giving us our guideposts and our knowledge about really where we are state by state and where we need to go and how best to use these new monies that Nicole has been speaking about. And then finally, we did want to share with you the contact information for both Nicole and for myself. Both of us are certainly ready, willing, and able to help in any way that we can with your advocacy efforts. And I can speak for myself that while I don't have all the answers, I know a lot of really brilliant people, and I'm happy to make the connections for you. Robert, I see that we are at 2:03. I'm not certain if there are other questions. There have been a few that have come up that I have answered privately, and some of them, one in particular piece is there's a question on a couple of slides that the person who asked the question was concerned that some of the information wasn't exactly accurate. Those are things that I need to follow up with Nicole on, and we will get corrected or amended information out to people once we've sorted through that. I haven't seen other questions. I don't know if you have some that you wanted to pose or if we want to thank our participants at this point in time.
Yes, we don't see any other questions at this time. So we wanted to give a very special thank you to you, Kim, and Nicole for what is a very informative and relevant presentation. We also want to thank all those of you who have attended this webinar today. If you wish, you can request the PowerPoint from today's webinar by emailing the webinar's Administrator Nicole Conning. Also, don't forget that the Adoption Support and Preservation Conference for Adoption and Child Welfare Professionals is May 31st through June 2nd in Nashville, Tennessee. Registration has been extended through May 31st, and on-site registration will also be made available. For more information, go to www.harmonyfamilycenter.org, where you will find a link for the registration form. Thank you very much.
Robert, I just want to add one more thing. I had launched a final poll asking what future support folks would need, and I see that about a third of the folks, a little bit more than a third, have responded. So just to let folks that are still on the line know, this information will be forwarded to Nicole and myself along with your contact information so that we can follow up with folks. And Nicole and I both thank you very, very, very much for all of your attention on this important subject.
Thank you.